The Long COVID Clinic, What You Can Do, with Dr. Binita Kane and Helen Oakleigh. Welcome back to the Long COVID Clinic, What You Can Do. This episode, we're going to be looking at a question that gets asked a huge amount, which is, I think I might have long COVID. What should I be doing?
If you think you have long COVID, the most important thing is to get checked out by a healthcare professional. The main reason to do this is not only to get the diagnosis, but also to rule out any other cause of the symptoms. Because the symptoms are so wide-ranging, they can overlap with other things. Equally, COVID-19 infection itself can trigger other conditions like thyroid disease, like diabetes, like worsening of asthma, like allergies. So it can be quite difficult to unpick what's cause and effect. But the important thing is if you have something treatable, to get it diagnosed, because often simple treatments can help and make you feel a lot better.
It's not something that can be self-diagnosed. So it's really important that you speak to your GP or a medical professional and you speak to them about your symptoms. A lot of symptoms can be very similar to other conditions. And so it's really important that somebody who's medically trained is giving that diagnosis. That's obviously a really important thing. There's lots of things you can do to help with that diagnosis. So what you can do is you can keep a track of what your symptoms are and how they change. You can keep a record of, does anything make it worse? Does anything make it better? Keep a record of all of that and write things down, write dates down. And then when you go and see your GP, which is most likely what your initial appointment would be, for some people, you might end up being seen in a more urgent situation, in which case this is even more important. Have that information written down, ideally printed out on a sheet of A4 paper if you're able to, but just written down in a way that you can share and that would jog your memory. A lot of people might have issues with their memory, especially when you're trying to remember lots of things all at the same time. Have it written down. Just makes things so much easier and you're not going to forget things.
Your GP should be able to refer you to the local long COVID hub, and they will have access to a wider range of tests and also to specialists. Most long COVID services have a baseline number of tests and investigations that they would expect a GP to have done before referral. Here's a list of those tests and investigations, just to make a note that you may not need all of these. There'll be some degree of looking at the history and the examination and seeing how you present, but this would be a reasonable set of tests that you should have before referring. A full blood count, U&Es, which looks at kidney function, LFTs, which looks at liver function, ferritin, which looks at iron stores, vitamin B12 and folate, HbA1c, which looks at blood sugar regulation, thyroid function, vitamin D, cortisol, CRP, pro-BNP and/or troponin test to look at the heart health, calcium, an autoantibody screen, a celiac screen, a chest x-ray, and an ECG. Some of the important things to rule out are anemia, thyroid problems, issues around menopause, perimenopause, diabetes, asthma, or other allergic conditions. One of the complicating factors is that COVID infection itself has been associated with triggering some of these things. For example, we see inflamed thyroid glands after COVID. We know COVID is associated with development or worsening of asthma, development of diabetes. So it's not easy to untangle it all and work out what's cause and effect. But the important thing is that if it's treatable, it's important to get it diagnosed. Simple treatments can often make you feel a lot better. If you have a question that you would like us to answer, please do get in touch, write it in the comments, and we will answer as many as we can.